Good evening, everyone. It's the first Tuesday of the month, which means it's Wildlife Vet Online live time. And tonight is episode 14, a very special edition. We've got a lion surgery we're going to talk about and show. We've got prizes. We've got a raffle. We've got quizzes. We've got a 24-hour sale. Loads going on. Let's go. Hello, everyone, and welcome, panel. How are you?
Hi.
Doing
well.
Doing well.
We've got Nicole from IVSA. We've got Max from RVC. We've got Layla from Nubs, Nottingham. We've got Beth from Bristol. We've got Orla from Liverpool. We've got Emily from Dick Vet in Edinburgh. We've got Izzy from Nott, and we've got Kayla from IVSA. So loads of you. Thank you so much for joining. We've got an exciting, jam-packed edition of our 14th episode tonight. So to start it off, I think, Izzy, shall we talk about the 24-hour sale?
Yeah, absolutely. So this is basically just a reminder to everybody who's watching now that we are now running a 24-hour sale of the lion surgery module. So basically, we want to run more events like this in the future, and we're going to give you a little preview tonight. And so we wanted to give you guys an opportunity to engage with the content and like get on board with the surgery modules because they're incredible. And so there's a 24-hour sale from 6 p.m. now until 6 p.m. tomorrow. And yeah, so just go along and buy it. It's only £15. And then as well as that, you can get the upcoming Lion module included if you just put hashtag TEP Lions in the comments. And then this will also enter you into a raffle. And I think Roger and Layla have a bit more information on what's up for grabs in the raffle.
Yeah, perfect. Thanks, Izzy. So Layla, let's talk about the raffle.
Yeah, so if you just pop into the whatever live stream you're watching in the comments, hashtag TEP Lions, then you will be entered into this raffle. You can get either something like from the accessory section on the TEP website. You can also email Roger about getting the surgery as part of the prize. And yeah, just contact Roger if you're the winner and you will be able to sort out an amazing prize.
Perfect. Thanks so much. And just a reminder, if you are watching on Facebook, just make sure you grant StreamYard permission to see your name. And you can do that by following the little link, which is facebook.com/StreamYard. We'll post the link in a minute just so that StreamYard can actually see your name. So if you do post a question or anything like that, we can actually see exactly who it is. And also, if you do hashtag TEP Lions, we can see which winner we're giving it to. Otherwise, it's just going to come up as Facebook user, just like I'll show you like this. And we don't want that, obviously. So the next thing we want to speak about is what do we got next? We've got, I think we're going to dive straight into it. So let's have a look at what we're going to be talking about tonight. Here's a little trailer. Wow, so that's what we got coming up tonight, and we're going to hand over now to Kayla and Nicole, who are going to do a little bit of an intro about exactly what we're going to be talking about.
Hi guys, I hope you're as excited for this as we have been. This live stream has been such a unique, experience to see and follow Dr. Rogers and his team from start to finish, from finding the lioness and darting her and following them all the way to the surgery and then through the surgery. I found it to be such a unique, experience just to watch and to learn from, especially being in vet school and being able to compare, the similarities and also differences between domestic and wildlife medicine. So we're just going to be, having a discussion about those similarities and differences throughout the live stream, and feel free to chime in and, ask us some questions along the way.
Definitely.
Perfect, thank you.
Sorry, yeah, no, we're very excited. So basically, we do want you guys to get involved. Don't be shy. This is supposed to be an open conversation. We want to get you guys involved and kind of thinking about things and participating. We'll talk a little bit more about how you guys can get involved with everything. And we want to continue to have more events like this. So this is kind of the first time we're ever doing anything like this, but I'm really excited for it. And I hope that you guys love it just as much as we do, and we can continue to do more moving forward.
Awesome, thank you so much. And that's not all, because we've actually also got some quizzes that we're going to be doing with us. So I think Beth's going to tell us a little bit about that.
Hey guys, yeah, so we have a really exciting quiz running throughout the whole session today. So kind of the order of events is we'll be watching some videos of little snippets of the lion surgery, and then afterwards we'll be posing some questions. So if you can comment the answer into the Facebook comments and put the number of the question beforehand, that will really help. But yeah, basically quickest, most interactive person is in a chance of winning a prize. So just, yeah, like the others were saying, get involved, don't be shy, just, put your thoughts out there, and who knows, you could win something. So yeah, it'd be great if everyone just got involved and had a good time.
So before we dive into the first topic, just another reminder, please make sure that you have a little look at the banner that's at the bottom there. If you are commenting or doing hashtag #TEPLines from Facebook, make sure that, so that we can see your name, that you follow the instructions at the bottom there where it says streamyard.com/Facebook. Go to that and just click agree, and that'll allow us to actually see your name when it pops up. And that'll be a difference between seeing this Facebook user versus the actual person's name like that. So just make sure you do that. Otherwise, we won't be able to know who we're giving the raffle to. Right, I think we're ready for the first topic. Over to you, Beth.
Is going to cover location, darting, handling, and transport of the lion. So we're going to see two videos, and the first one is the location and the darting, and the second one is the handling and transport. So when you're watching these, just be sort of thinking in your mind about different things, the difficulties of tracking the lion, or the difficulties of getting through the bush. How did the team get out there? What sort of vehicle are they using? How they're keeping the team safe, their communication, their teamwork. And maybe you could even think about what they're darting the lion with, what sort of drugs they're using, try and keep a clinical mindset as well. But yeah, if you want to play the videos, Roger.
Perfect, let's go.
Is that her? I'm not sure that's her now. Those ears look fine, eh? If they go down there, that's better. In the riverbed.
Yeah, but I could get a shot from it. Yeah,
I just want to make sure. Well, I only see one chunk, not two.
Could be another one.
Yeah, I'm just trying to have a. This looks like all the. I mean, what do you think?
Your almond said it was.
Dad, are you sure this is bucket? Yeah, but the ears were that we took out of the top, not low. It's coming. Okay, I can see one. Def, yeah, okay. There, yeah, okay.
I can see 4.
Um,
Okay, she's quite relaxed. Now she's facing us.
I'm gonna sneak forward.
Yeah. You go through here. I can get a shot.
Cool.
I don't want to get on the Uterus, yeah?
Yeah.
Just carry on. Forward more.
Forward more.
Yeah, I've got to get a side on shot. Don't worry about me.
No, I'm just worried that's... Yeah, that is definitely...
Not a great shot. I can get it, but it's not a... You guys ready?
Matt, you ready?
I'm rolling now.
Just trying to see. See, I've got a sort of a neck shot. It's not the best. Let's just see. It's a nice shot.
Nice. Straight down the hill.
Yeah.
Okay, so that's part 1. We've got the next one coming up.
Oh, there's another one here, huh?
No, I couldn't see that one.
The adult
I've worn a
liners.
hat for 35 years.
I mean, I wear a hat, but only...
Yeah, but also I've got the same. I've got nothing.
Kaya,
I've got nothing to cook.
you feeling strong, buddy?
Yeah, come yeah, feeling strong. Okay. No such thing as a free lunch.
I come this side. Oh, it's good. Pull them onto
Yeah.
1, 2, 3. 1, 2, 3.
She is big.
Yes.
So bottom part's heavy part.
Now we're gonna put the head to that side, eh?
2,
Yeah. Oh, you're nice and strong.
head first.
That side.
Yeah, so
But too old.
Okay, you guys ready?
Pete, do you want me to take the heavy side? You sure?
Yeah.
Yeah.
1, 2, 3.
Ew, bloody fat girl.
You talk about my ankle. Okay, so this is the difficult part.
Okay, do you want me to come help you there? Let me just let me get past so I can go help my friend. Yeah.
Okay, you guys ready?
Yeah.
1, 2, 3.
No?
Just one more. 1, 2, 3. Okay, yeah, well done.
Big girl.
She's not there asleep, eh?
It's a good thing she's in your car, not mine.
Yeah. Won't be the first time I've heard of cheating last night.
And then we'll meet you that side.
Yeah, that's what the book says.
Now Vim's already on his way to your side there.
Did he come back here?
No, he's going to meet us at there.
Because he was there originally.
Yeah.
And what I'll do is I'll see you to the top then.
Yes.
Then get some work done. And I'll leave you operating.
Isn't this work?
I don't get paid for this.
Well, I hope you do.
I remain the unpaid manager of the reserve, so I can resign at a moment's notice.
Oh, so I suppose
I get too much free advice.
How many people have asked me about this buffalo already?
Is it?
Which buffalo? Next door's buffalo.
No, Provet has got a plan.
Yeah, let me just...
No, I chased them when we got out of the car. Told him to footsack.
Yeah, apparently lions understand footsteps.
Yeah, that's it. Yeah. We might be going to film the capture of 300 buffalo
Where? With Kester?
in Zim,
Oh, okay.
Pamashana,
Okay.
and moving them to Mozambique. Well, we'll wait. We've put in quotes for it, but we'll see what happens. So we're not doing that for free.
No.
Sorry. I'll sort out later. I think we've got like 2,500 rand that we can donate from this.
So Pete, if you want to get paid, it's the limit's 2.5.
Yeah. Watching us. Look at that.
Oh, shame. Run over there too. Oh, no? No.
What are these people doing?
So we've just darted bucket. She's loaded. Fortunately, no signal down in the valley, but her half sisters are keeping a watchful eye on us. And there's bucket loaded off on her way to surgery.
What's your plan to get to the...
We're going to go now.
So I hope everyone enjoyed those first two videos. Yeah, so we're going to dive into the quiz, or the start of the quiz. But beforehand, it just might be worth saying that, you know, if you've got any ideas or questions yourself or any comments, pop them in the Facebook comments, because we're going to have a bit of discussion at the end. And any questions that we can't answer, we'll just store them in a bank so that we can ask Dr. Rogers later on a different live stream. So just be curious, you know, get involved. But yeah, we'll just start the quiz and, you know, be quick, and hopefully you're paying attention to the videos. So if we can get the first question up. Question number 1, how do they identify the lion who's called Bucket and differentiate her from the other lions? Okay. Hopefully people are popping their answers in the comments. Be brave. Just let people have a chance to type them out.
Loads of questions coming in already. Well done, everyone.
Brilliant.
Wow.
So question number 2. So if you haven't answered question number 1 and you quickly want to put it in, but put number 1 first. But question number 2, why did the team cover the lion's head once she was started? Yeah, lots of good answers here.
How the society's looking there, Izzy. It looks like from my side, I can see Bubs are racing ahead a little bit. Close coming in second. We've got Dick Vet, then we've got RVC, then Nuvs, IVSA, Glasgow. Actually, no, Glasgow's in there as well. Sure, everyone's doing so well.
That's fantastic. Yeah, keep getting them in, guys. And if you are a bit behind, just remember to put the number of the questions so that we can go back and look.
Yeah, it's great to see everybody's involvement from all the different societies. Just keep on, you know, plugging for your society. May the best win.
Question number 3 is up now. So what clinical procedure does Bucket have done in the van before they drive her to the surgery? So you needed to be watching carefully.
Sure.
Yeah.
I don't think I've ever seen so much activity in the comment section and live stream before. So you guys are doing amazing.
It's brilliant. Well done, everyone. Yeah, I love everyone getting involved.
Cool. Okay, fantastic. Are we ready to move on to the next topic? What do we all think?
Yeah, definitely.
Great.
Sounds good.
Okay, so who we got up next? We're going to hand over to the next topic. We're handing over to Orla.
Hi guys, so in the next clip you'll see the team aseptically preparing the site for surgery.
They've already clipped the fur, so you'll see them scrubbing the area to remove contamination. And as this is an intra-abdominal surgery, it's crucial to clean the site as much as possible, as the risk of infection is pretty high. And as you can imagine, with her being a wildcat, the risk is probably a lot higher than it would be in domestic species. So while you watch the video, have a think about the different aseptic agents they may be using, how the team work together, how the surgical preparation compares to small animals, possible consequences if aseptic technique is not carried out correctly, and also have a look out for one of the team members comparing the size of her paw to his hand, because it's pretty cool and really puts her size in perspective. So yeah, I'm ready for the first video.
Cool. Okay, so the first video is going to be about 3 minutes. Here we go.
Okay, welcome. We are in the surgery at Provet with the one and only Doc Rogers and his team. So I know lots of people have quite a lot of questions. Why would we do this rather than an implant or another form of sterilization?
Now look, the implant, if it lasts anything between, that's the hormonal implant that we put in under the skin. It lasts anything between 18 months and 3 years. So the problem is that, what can actually happen if the animal comes into estrus again, she can breed. So yes, she's related to the males in the pride. So the last thing you want is cubs from her. If we use the implant and then repeat it after 3 years or so, they can put on a lot of weight.
And it's a lot of darting and...
Yeah, and they can get cystic ovaries, all those hormonal stuff. Whereas so you can also tie the tubes off, the fallopian tubes, but then they come into estrus all the time.
And that's what we had with next door, with the males constantly coming through, and it's not guaranteed.
Well, it's pretty much as much as guaranteed, but the problem there is that they keep on coming into estrus, and they can develop complications at a later stage, hormonal problems. So this technique now, where we take the whole uterus out, is I was always worried, because dogs and that they tend to put on a lot of weight afterwards, and they lose their female characteristics. But apparently, the guys have done a lot of these before, so that they don't have that same tendency. So we don't want this female ever to breed on this reserve again, because she is related to the others. So this is a permanent solution, and it's from a practical point of view. One's got to remember, that when you've got 4 fences around a place, that you've got to actively manage these lions. If they carry on breeding, they're eating all the animals, they turn it into a botanical garden.
Yeah, and you've got problems with, you've got cheetahs, you've got other predators, and a high lion population will put pressure on the other predators completely, But I mean, so this little lion's had quite the life so far. Lots of car rides for Bucket.
Yeah, you rescued her in the beginning.
Yeah, when she was tiny. Obviously, like all surgeries, getting the area clean and ready and sterile.
That's why it's better. We were going to do it closer to the actual darting site, but you want a surgery theatre environment, because although it's a routine procedure, it's a very invasive, and it's a difficult procedure. So we do a lot of them, but the fact remains that it's a very sterile procedure.
Yeah.
So if we can work under these conditions, we've got access to everything that we can't suddenly say, we forgot something at the practice. So we've got everything at our beck and call here.
Not stable.
So next we'll see Dr. Rogers administering a bit of anaesthesia into the medial saphenous vein as the surgery is about to start. So you'll notice that they're still preparing the site pretty much up until the drapes are put on. And they also have a bit of a chat about how she'll stay in an enclosure for a bit to recover so that she doesn't pull out her stitches. So in this one, have a think about possible drugs used for anaesthesia, how they can monitor anaesthesia throughout the surgery, the importance of IV catheter placement, difficulties in administering anaesthesia to a lion, and the dangers of spontaneous arousal and how this could be avoided.
Okay, so this one's about 4 minutes long. Here we go.
Hey,
What's wrong?
Yeah, bastard. It's a good thing I have a waterproof case. I wondered what the hell was going on there.
I think I'll do a break.
I don't know. Got pinched in something.
Big kill.
Don't worry. Go on. I will pick it up. Okay, now work from there out. And then this way. Another foot.
I think the electrical clouds are on it.
Good.
I don't know if it's
From there out.
necessary.
Okay, now you can do the sides. But outwards, from there out like that. Okay.
So there we go, guys. Sorry about that. We're having a few technical issues, but we're back live from the Provet surgery. And Dr. Debbie English is getting ready to actually, I suppose, do the procedure. The correct term is a uterectomy. A uterectomy. Okay.
Just going to have to go back. I don't want
Back?
to close to the wound.
No problem.
Gaan jy so kan werk?
Ja.
Moet ons al...
Nee, as iemand dan net...
I want us to move this around a bit here.
Okay.
Boertjie, you're right there.
Ja, natuurlijk.
Stop sneezing. Give you some cortico IV. And you want a dexamethasone tablet with it. Antihistamine.
Prednisone.
We're gonna have to treat. We're gonna have to test you for TB afterwards.
Okay, thank you, Gigi.
Net sê as ek kan weer apart is.
Ja, glad. Dit is nou klaar.
Ready to go.
Ons nou klaar.
Ja.
Ja.
Wendy would like to know, have you had a lion on this table before?
Yeah, we have.
Yes, yeah. A few, I think.
Yeah, we have. I mean, Bucket's been here before, eh?
Has she? No, she has. I was about to say, no, she hasn't.
Just want to pull this leg straight.
And I think we're going to have to tilt towards this line. Quite a bit towards more. I think if,
Okay,
yeah.
so like,
Yeah, perfect.
just hold her there.
Just hold.
Ek gaan die tafel 'n bietjie draai. Net so klein bietjie.
Ja,
Dat
perfect.
hy net dat hy net 'n klein bietjie swaai.
Perfect.
So.
Poor bucket. Now, of course, after this, she's, as I said earlier, she's going to actually go into the BOMA to recover. And how many days will she be in the BOMA for?
And you know, it's the thing is, we're cutting through the muscles into the abdomen. So, you know, she goes up and then she tries to kill a water bug the first day. You know, she might tear all her stitches. So the whole idea is to let it. It will probably try and keep you in about a week.
A week.
At least a week, eh?
And she's lucky. She gets free meals for a week.
Correct.
Doesn't have to go chase anything.
I might join it.
Okay. So she's just got a top up.
No, I'm just clearing the catheter.
Was hy geblok?
Ja. Ja, dat is het. Ja, het is geblok.
Fantastic. Over to you, Ola.
Yeah. So are we ready for the questions?
Yeah, let's go over it.
So question number 4 is, while monitoring during anaesthesia, what does the SpO2 level tell you? And remember when you're answering it to put the number of the question.
And also remember that if you are answering on Facebook, just a reminder again to grant StreamYard permission to see your name. The little link is at the bottom of the screen now. This just obviously gives us a chance to see your name and also add into the raffle as well. Okay, next question coming up.
So question number 5 is, what extra step is often required prior to intubation of a cat to prevent irritation of the larynx? So yeah, I know they do this in small cats, so I'm interested if they do it in big cats as well. I don't know what you guys think.
Definitely. I was always wondering that while we were watching the video, because we don't ever actually see the intubation or any of that kind of stuff. So I was like, is this cat just getting a CRI the entire time, like the lion, or is it under some sort of maintenance drug and that kind of stuff? So I was kind of curious about it all.
Yeah, it'd be interesting.
Yeah, my roommate and I were talking about the size of the tube you would need for this lion. And comparing that to, you know, tiny cats, it's much different.
Definitely. It'd be almost like, have you seen like the equine intubation tubes that they have, just how massive they are? I'm like, I almost think you'd have to have something like that.
Yeah,
definitely.
Then you'd probably have to consider the fact that if they do bite down or anything on top of it, that they don't actually like break the tube. You'd be like, let's try to make sure it's all sturdy.
So question number 6 is, which anesthesia drugs are most often used for maintenance? Have you guys ever seen any surgeries or done work experience with any large cats or lions or anything?
We did actually, as in South Africa last time, there was a lion that we were actually doing a different procedure on. We ended up doing the implant that they talked about in the video at the beginning. So yeah, this is just kind of very different to watch an actual spay in progress and kind of be like, oh, like think about the different methods that exist out there for managing all of that. But yeah, we just did our anesthetic or anesthesia rotation, and that was also really interesting, taking into consideration the do's and don'ts for different animals depending on their health status. So I'd be a little bit curious to know how they consider that kind of stuff when looking at a lion from afar, kind of like you can't do like a full blood work panel on a lion initially.
Yeah, I mean, I guess it's a lot harder for them, isn't it? I wonder how many spays they do on lions as well.
Definitely.
He did fantastic.
Say it was a bit. Oh, sorry, go ahead.
No, go on.
I was going to say, he did say it was like a newer technique Roger was mentioning in the video. So I'm curious how many, like you said, that they've actually done to kind of see where the studies are going on that and like how the effects are. And I guess just also how are they picking which lions, like which genetic lines to kind of manipulate or change and who they're picking. It's an interesting thing to think about for conservation purposes too.
Yeah, definitely.
Yeah, we must keep these questions for Dr. Rogers next month, definitely. So thanks so much, Orla. That's your topic all done. That's all your questions done, right?
Yep.
Okay, perfect. Izzy, how are we looking at the societies? Who's on top at the moment that you can see?
Oh, it's so hard to keep track of because everybody is commenting so like thick and fast and everything, but where I'm sitting at the moment, RVC are doing really well, and Dick Vets are really, it's really tying RVC and Dick Vets. So yeah, you got to keep on competing, see who's the best society. I don't know how it's looking for the guys that you're
I've been keeping an eye on Bubs and Liverpool as well, a little bit on IVSA, also racing through it, really. So much participation today. And I think this is one of the most active live streams we've had. So thank you all once again so much. Just a quick reminder, 24-hour sale happening between now and 6 p.m. UK time tomorrow. So make sure you buy the lion surgery module during that time. And if you do, you'll get thrown in the actual African lion wildlife vet online module as well. It's not quite finished yet, but as soon as it comes out, it'll be added to your account. So just make sure you get active and make that purchase while it's cheap and while you get the bonus module as well. So thank you all again. Right, I think that's the end of all his modules. So we're moving on to Emily next, I think.
Yep, it's me. So in this next module, we're going to actually start looking at the surgery that's going ahead. So I guess one thing to pay attention to is just the differences between a cat spay that you would see in just like a small cat and this being a big cat. They're pretty similar. Differences. One of the biggest differences being location. Although this one is in a surgery suite, it's not always possible to be in a surgery suite. And in fact, the only reason why this spay was done in a surgery suite is because the weather was awful that day. And then just the sheer amount of like subcutaneous fat layer on there as well, much larger than a cat.
Cool. So this is going to be the bulk of the videos now. So we've got quite a few videos that have been clipped and condensed now. If you do buy the lion surgery module, you'll get the whole thing from start to finish, which is 2.5 hours in total. But we've condensed this main little bit in the middle down to probably about 15 minutes or so. So really, it's going to be broken down into a few clips. So yeah, let's get stuck in. Here comes the first one now.
Got it? Lekker. Quite close to.
Okay, so there we go. The incision is being made. Julie wants to know, how do you stop a lion licking its wound? You don't.
No. But they don't usually. I mean, they battle to get to that spot. Eh? They really battle. You see, she's in really, really good condition. Eh? You can see the fat that she's going through.
Yeah.
Okay.
Just don't touch the green stuff. That's all.
Yeah.
Thanks.
Sorry, guys.
And of course, one of the reasons she'll have to be in the boma is because there is a lot of interaction between the pride and the individuals, and they fight over carcasses. So this is one way to ensure that she doesn't actually have to fight for food, and for the whole week she will get free meals. Sure. I know. Incredible what good condition is. That subcutaneous fat layer is really thick. You could come hold here for a sec. Just get it. You see where my hand is? Go. We're breaking up. I'm trying to. Bien plus off here. There's a problem with the no-tail line. We might just move our vehicle to the back and use. We'll see what happens now. I'm just waiting to hear from them. So apologies about the breakup, guys. We are working on it. Okay, so sorry about that, guys. We're back now. And as you can see, Yuka has taken over for me for holding up Bucket's leg. And Dr. Debbie is getting right in there now. Now, of course, if you are a bit queasy, you might not want to look at this.
Got it. So here's the uterus and the ovary.
Okay, so
Yeah. Fish through a lot.
Just swallow some water just to
Julie, she's definitely not pregnant already, fortunately. So that's one of the reasons it was quite imperative that this was done soon, before she mated with her father, one or her fathers. Difficult to say which one. Julie would like to know, is it the same as a little cat, just bigger?
Yeah.
So exactly the same now.
Yeah.
Sorry. Oh, sorry.
either way.
Big one, please. The two.
Can you just plug it in there?
There isn't one.
Look at these.
Yeah.
This measures the oxygenation of the blood.
Yeah, Matt, if you have a look here. There you go. You can see.
So that's the oxygenation of the blood, and that's the pulse rate, which is quite nice.
And you always want it, well, I suppose, as close to 100 as possible?
Yeah, we're going to put some oxygen on now. Just to, we can in the field, you wouldn't be able to necessarily. It's actually going up 95, 96, so that's pretty good. And we just do it on the tongue. We just put the little
sensor
on the tongue, yeah. Okay, so it's going up to 97. So we're going to just give a little bit of oxygen. You'd probably be fine without it, but if you've got the opportunity to use it, why not?
There we go.
Nice one, big water. That's what they all say.
Oh, Uncle Pete.
Couldn't let her get away with that.
Yeah. There's always a risk doing live broadcasts with Dr. Pete Rogers because you never know what he's going to say next.
You know what? It's quite a tense procedure, so a little bit of humour just.
Yes.
Especially that I'm doing nothing, so I can make jokes. But the youngsters all at work, yeah. Except the surgeons with TB.
I really don't.
Yeah. so everyone wondering there, Dr. Debbie is actually allergic to lions and cheetahs, you said,
Yep.
in particular. So before she does this, she has to take some antihistamines.
Oh, yes. So just making sure that we're tying everything off and not tying fat and intestines with it.
All right, yeah, so that was the first video. Like you could see that she was clamping off the right ovary, and for removal takes a little more effort than in a little cat, but it's still pretty much the same. So this next video, it's going to be more of the same procedure of trying to like exteriorize the uterine horns and everything. So it'll be more in detail. There's going to be three 3-minute videos coming up, just more of the same space surgery.
Here we go.
Actually, it's a kleiner.
Really?
Yeah.
Smaller than a Rottweiler?
Yeah.
Wow.
Yeah. There's a lot of more fat and tissue, but the uterus and the ovary itself is really an anticlimax.
It's a rather stick that way.
Yeah, let's not say.
Don't want to be a thriller there.
Say too much.
Thinking actually she's standing outside the door. To make bad experiences last night. The ghetto wasn't big enough for her to run away last night.
She's standing here, okay. Should be learning.
What were you working on last night?
Well, that's what.
Huh.
Omdat die leer hier.
Is it quite not work after that?
Yeah, it will look at that.
Oh, is it? Is it?
No, kijk, maak het uit.
Yeah, good here, Bob.
All right, so yeah, moving on. In the next upcoming videos, they're going to start actually getting the uterine horns out, and you'll be able to see the similarity in size between a lion and honestly even a dog for uterine size.
Okay, here we go.
Sorry about that, we're back live, guys. It just seems to be, there's some very thick walls here. Nearly done. So, one really interesting thing you missed is that, so, buckets, uterus, and ovaries are actually smaller than that of a Rottweiler, which I find quite fascinating, because obviously she's quite a lot bigger than a Rottweiler.
Did you back on the box or you off the box?
I'm off the box. It's too high.
Couldn't see the line.
No. Fan is too much.
Put that fan off.
Matt, just keep filming.
So close to it.
Trying to get a good thing here.
got us back for him. Okay, so we're nearly there, guys. Sorry about that. Now, just remember there will be the recording of this, which will pop up afterwards without any of the intermittent breakup, so you won't miss anything.
Hazel, can you open that second packet of swabs for me, please?
All right, so again, you see that it's a little bit more difficult requires a little bit more brute strength for this procedure than maybe in a small cat. But then this next video, it's going to be her closing off the cervix blood supply and then actual removal.
The surgeon is easy. Well done, Dave. She's going well there. Trained you well.
And then she'll be waking up slowly, I'm guessing, on the other side. So you won't give her the fast wake up.
We will, but the problem is, we've been using, you see with this combination, we use the medetomidine and the ketamine. They can go from 0 to hero. I've got
this kind of cheetah scars, yeah.
So what I do is I give them a little bit of what they call telazol or xylitol, which has got a bit of Valium stuff in it, Valium-like, so they wake up gradually.
Okay.
But that's the only thing, is that you don't want to give too much, because otherwise they take hours to wake up.
Okay, yeah. And I mean, that's one of the big...
Sorry?
Sorry, we're just having a...
senior moment. At least
we should talk to Neotel.
Put it on dark before we...
Yeah.
Fat Rottweiler.
It's okay.
You don't want your lady to scrub up?
It's okay, thanks, Pete.
Everyone's hoping you don't faint, Yuka.
I was hoping the same.
Better put a pillow there.
Yeah.
Funny things. We've had plenty of people
faint down.
Can you check that corneal reflex there, Janelle, on it?
Yes, it's able.
I just gave her
BMP?
0.75 of a milligram.
It's just flexing.
Yeah, it's conventional on the line.
Wow.
I tried to do
0.75 of a milligram. Don't do it.
It's right there.
That's it. Too many walls.
Like a hole in it. I'm sure I can get Paige to break it.
Yeah.
Easy. Vicky Walker.
Okay.
Yeah.
So it's Neotel. Matt, just lift the camera up where I can see it.
Pulling a little bit.
How's it looking? So we need to know this if we're going to get one of these lines.
It's very pathetic. It's 10 megs.
Really?
It's not that hard to get a 10 megs line right.
Yeah, but that's why these internet oaks are such crooks. How? These internet guys are such crooks. Neotel and all of them. They're supposed to be, I mean, we can get a more stable line out in the middle of the bush than they can get into a building in town.
All right, so that was more of the procedure, and as you can tell, the live stream was going a little poorly with streaming, so you get the banter of that. And so this next clip, there's one more clip of the surgery, and that's going to be more of the removal of the uterine horn, uterine body, and starting to close up this surgical site. So
thanks, Emily. Here we go.
Matt, how are you doing there? You got a good angle?
Yep.
So that's near.
Culprit.
There we go. There's actually a question from Judy. How long is a lion's uterine horn? That long?
Right, that, yeah.
So 10, 12 centimeters.
Yeah, 13, 14.
Maybe.
Closer.
Yeah.
This one is.
Oh, sorry. I'm just going to wait for Janelle just to bring me something to infuse into this abdomen. Ja, jy kan maar net hier. That's just a bit of a hemostatic agent, just to slow down any bleeding that there is. But there's actually
Almost none there, yeah.
And we can put some antibiotics in there.
Okay. Later. Janelle? Kan ons 3 maal bytrol kry asseblief? Ja, nee, 5. 5 is wat.
Murphy's Law.
5.
Yeah, make it 5 genetic. Groot bykry. Looking good, Dr. English, looking good.
Kan ek 'n naald kry waaraan ek cat kan vassit? Ek gaan transfixing sutures.
Gaan jy 'n groot naald soek?
Ja. Goed.
Bytrol in die water ook. Hoe groot?
Nee, nie huge nie. Wat so groot is, weet jy?
Baie, verskillende sizes.
So groot.
Go straight live. Sorry about that. We're back. Julie, to answer your question, how long is a lion's uterine horn? You can see them there. They're about 10 to 15 centimeters. We're nearly there, guys. You can tell everyone she spent her Friday hugging a lion.
All right, guys. And then one thing I forgot to mention before that clip, so they actually added a hemostatic agent and antibiotics directly into the abdomen, which is something I haven't seen before. So that's like, I think a little bit of a difference between, you know, small cats and big cats is you get the, you need a different method of prophylaxis for antibiotics. So our first question is, what is the official name for the surgical technique demonstrated? So not spay, but the more scientific name. And then I know it was brought up by someone if there's a reason why we're sterilizing these females rather than just moving them to different locations, because there is a declining population of lions. It's just that in South Africa and in the area that they're at, like the specific pride is at, they are actually a little too abundant, including with other predators in the area. And so part of the reason why they're sterilizing her is to stop her from inbreeding with her father, which is why they wanted to catch her before she even got to maturity. And then two, it's just that the numbers around that area are too high and there's too much competition with predators. And one reason why they chose spaying versus like a sterilization ring is that there's less upkeep. Like you don't have to keep darting the lioness to with a spay, whereas with sterilization rings you have to continue to upkeep them. And the first implant isn't necessarily going to stop her from coming into estrus. You might need more than one. So question 8, what is this incision called?
I don't know about you, Emily, but yeah, with this question, I did find it a little interesting just because it does kind of differ compared to what we do here in the UK, specifically with cat spays and how they do it. Whereas like you had mentioned earlier when we were talking about it with the US, it's still very similar in how we'll spay a cat where we make that first incision. But definitely a question to maybe ask Dr. Rogers later on as well is, I guess, what's the benefit of doing it this way without giving away the answer? The benefit of doing it this way versus like a flank spay or something like that. And what, like, if that's something that they've considered or if anyone's tried that yet to see if that might be a better option. So there's less upkeep on those stitches around the abdomen area.
Yeah, I agree. It's a good question. And then our last one for this section, what ligament connects the ovary to the abdominal wall? But yeah, to piggyback off of you, I wonder if it has anything to do with just damaging muscles in lions because they're larger, or just ease. You never know.
Well, I was just thinking too with the antibiotics that they used. I know that can be just a bit controversial with, well, at least with small animals, and trying to like maintain prevent some resistance. But I think it might be a bit different with wildlife medicine, and that you want to take every precaution necessary. It's a pretty big incision, and they live out in the wild, obviously, so they're going to be exposed to a lot more pathogens and dirt. So I think that's definitely something to consider too.
Especially because it wasn't shown in the video, but in the longer video, you see they literally pull out a worm out of her abdomen. So
yeah,
clearly
I don't think
not
you'd
the
see that in a house cat usually.
No,
not like that.
I took a judgment call on removing that. I didn't like seeing that at all, to be honest. Thanks so much, Emily. That's a great sort of summary of that side of things. We just let everyone know we're running about 10-15 minutes over, so we're going to be another 10 minutes now, just so that Max can do a quick wrap up, the final part of the surgery, which we're just going to show some stills with. And then do the final prizes and the raffle and all of that. So please stick around, 10 minutes to go, and then we're all done. Thank you so much for joining in so far. Just a very quick shout out to a few so far: Danny, Cassandra from Glasgow, Izzy and Geordie from Nottingham, Sophie, Emma and Emily from Edinburgh, Rianne from RBC, London, Emma from Liverpool, Danny and Emma from Bristol. You guys have been doing amazing so far, definitely doing fantastically. But I'm going to hand over to Max now.
Thanks, Roger. Hey, guys. Yeah, so the last topic is kind of a short one, but it focuses primarily on stitching up the surgical site after removing the uterus and ovaries. Yeah, as Roger mentioned, I believe we have some stills to go with this. But additionally, on top of that, the last video from the previous topic also covered stitching, so I hope you guys were paying attention to that. So yeah, following removal of the uterus and ovaries, 3 layers of sutures are placed to close the surgical wound. These 3 layers are in the abdominal wall, the subcutaneous tissue layer, and skin. Something that I think is important to consider, and for SPAs and really any kind of procedure, is that once you've done what you needed to do, and before you close up, it's always important to check the abdominal cavity for any kind of internal hemorrhaging or any kind of missing gauze and swabs. I know I've been on placements before where, the veterinarians will always say, count your swabs. But yeah, and then if you move on to the next image, that's the full, that's after the 3 layers have been placed. And as you can see on top, there's, well, I don't want to give away the question, the answer to the question, so I'm going to leave that alone. Roger, can you actually go back to the previous picture again? Something else I wanted to note that was mentioned in the live surgery video was you should note the thickness, the great thickness of the subcutaneous layer. That was something that was mentioned by Dr. Peter Rogers. And I believe this is similar in domestic feline cats. Yeah, so we can move past that. Yeah, and then we also have some quiz questions if we want to go through those. So the first one is number 10, and make sure to write the numbers. What is the anatomical structure suture to close the abdominal wall?
Yeah, Max, I was wondering with the layering of the fat as well, how difficult that makes the surgery. Because I know whenever we get a dog in and they're a little bit on the chunkier side, it's always one of those things that we're like, oh man, we gotta have to like dig through things. And like, I mean, this is probably normal for them, but I'm just kind of curious how that would affect the spay overall, if it makes it a little bit more slick and hard to grab a hold of things or what.
Yeah, I was totally thinking the same. And I was also thinking of it kind of along the lines of suture reactions as well, because it made me think of if it's similar to cats where, reactions to sutures are kind of relatively common. Maybe it's a question for Dr. Peter Rogers, but I wonder if it's the same in lions. All right, next question. So number 11, for each of the 3 sutures.
Does someone want to take over Max's reading of the question?
Sure, I can do it. For each of the 3 suture layers, what technique or knot was used to close up? We seem to have lost Max.
Let me take his face off the screen, Shane. I'm sure you wouldn't like a frozen image like that.
Yeah. But yeah, I guess to piggyback off of Nicole, it is really interesting too, just and off of Max, because some of the sutures that they were using, the type of suture, I know like sometimes they tell you not to use in smaller animals. They definitely used much thicker suture than would have to be in small animals. And then question 12, why does a subcutaneous fat layer have to be closed?
It makes you wonder too, with the specific suture that they used, if, lions do have sort of tougher skin and just like thicker layers overall, whether maybe they wouldn't have that inflammatory reaction that small animals would normally have, that's prevents us from using that specific type of suture.
Yeah,
possibly.
Yeah,
anyway.
Because it was catgut, wasn't it, that they used, which I know, at least my lecturers were like, just don't use it.
I think, our lecturers said that too. But then there's some people like in more of like the shelter realm that tend to swear by it. But I think it's
really preference, honestly.
Yeah.
I think with the shelter, I was gonna say, I think with the shelter aspect of it too, it's like a lot of times it's like a catch and release. So that's where you can kind of think about it in this case, is you want to make sure that those knots are going to stay tight and hold, whereas like they've already put antibiotics into the wound, so maybe it's not as much of a consideration as it would be for like a small animal type of situation.
Yeah, and I wonder how often they sort of check up on her once she's released back into the wild, or how they keep track of her, or that sort of thing.
Yeah.
Fantastic. Max, is there anything you want to wrap up with on your section? Thanks so much for that.
No, I apologize. My computer literally just crashed. I'm assuming the last question was covered.
All done.
Yeah.
Oh, okay, great. No, then that's everything. Thank you.
Okay, perfect. Izzy, do you need any more time on choosing the winner for tonight? Or should I give you another couple of minutes, or are you ready to go?
Yeah, I was just gonna put it, we've got like loads of people who engaged like massively well, and like so many people got all of the questions right because you're all too intelligent. So I was gonna do a little random name generator, so I might just go aside and do that.
No worries. Okay, you go and do that. We'll let the panel, we'll discuss in the meantime. And what I'm going to do in the meantime is I'm going to talk about the engagement, the Society Engagement Awards. So Izzy will let you do that and come back when you're ready. Panel, just wrapping up that surgery as a whole, are there any sort of final thoughts before we move on to the sort of the fun bit and the award side?
I would just say it's worth watching. It was pretty cool to see, and it's just cool how much you can actually apply your knowledge of small animal or farm animal to way cooler species.
To jump off of that, a common theme that I think we were all kind of talking about was how similar this was to a cat spay, and how similar it is to the small animal surgery.
Yeah, and watching the whole thing definitely does make you feel like you're really there. So I definitely recommend it.
I think this discussion was also super helpful for, I don't know, maybe not making you feel so terrified about the idea of doing surgery on the lion, or just like in general, working with animals like that. Because we don't really get to learn a whole lot about wildlife specifically all the time, but we do get a really great foundation in our domestic species, and being able to take that knowledge and then get creative and apply it to a wildlife situation is really interesting.
It's amazing how relaxed everyone is in that theater. I actually thought, I don't know, hey, they're all so chilled.
Yeah, I just think it's an amazing opportunity, especially if you can't get out to South Africa and you can't, travel at the moment. It's just, it definitely feels like you're there. It's just brilliant and a fantastic opportunity. So I would highly, highly recommend.
I think in the video, Dr. Rogers even mentions that the reason why he's not the one doing the spay himself is because he hasn't done a spay on a normal cat in forever. So I was like, oh, that's kind of an interesting concept. Like this guy who's just the end all be all in wildlife conservation medicine at this point, he's like, nah, leave it to the professionals.
Awesome. Okay, thanks so much, guys. That was absolutely amazing. So just a reminder for everyone before we now do the draws, 24-hour sales going on until 6 p.m. UK time tomorrow evening. If you buy the line surgery video, which is only £15, discounted even more if you're a society member, which most of you watching will be, so you get even more discounts for that. If you buy it for that price, you'll actually get the African lion module thrown in as well as the surgery module. It's not quite complete yet, the African lion module, but it will be soon. When that comes out, we'll add it to your account, and that's only if you buy it during this 24-hour period. So thank you for all of you for participating. One last little request. I think, Layla, we need to remind everyone just about doing the hashtag TEP lines one more time before we do the raffle, right?
Yeah, so if you haven't had an opportunity to put hashtag TEPLines in the comments of the Facebook live stream or the YouTube live stream that you're watching through, then do that now, because we're literally about to do the raffle draw.
Perfect. And don't forget, if you haven't done it, the streamyard.com/Facebook so that we can see your name. Otherwise, if it pops up with no name because you haven't done that, then we can't give you the prize. Okay, I think we're almost about ready to hand over to Izzy. So just before I do that, I think I'm going to announce the Society Engagement Award. So what we're doing now until the end of the academic year, so June in 2022, we're going to get a sort of an idea through each of these live streams, which society is kind of participating the most, sort of having the most engagement, turning up, asking questions and stuff. And what we're going to do is we're going to accumulate winners throughout the next few months. And then at the end of that, have a nice award, maybe even try and sort out a trophy that can be handed over each year. We'll see if we can do with that. But definitely try and organize a dinner for, all the society members or something like that, or a fun barbecue in the summer or something like that. So make a plan to get the winning society. But for this week, the award goes to Bristol. So you guys have done amazing. So Bubs, well done. You had the most engagement today. Fantastic job. Keep it going. You're a new addition to the TEP family, so welcome. And you really grabbed it with both paws, shall we say, tonight, and really got stuck in. So thank you so much. Izzy, are you ready for the quiz winners?
Yeah, I am. Turned off my camera instead of turning on my mic. A bit of technical difficulties there as usual from me. But yeah, so in the end, we had 14 people who made like incredible contributions throughout the live stream. And I just put them into a random name generator, and I can reveal that our winner is Ellie Veroci from RVC. So congratulations on winning. So if you contact Roger, then he will be able to talk to you about like what prizes you might want. So congratulations.
Yeah, perfect. Drop me an email, Ellie, and we can discuss what we can give you. There's a few options. We've got some TEP accessories which are available in our TEP shop. You can choose one of that, or you can get this module given to you if you haven't already bought it. So you've got a few options to choose from. Thank you so much, and well done to Ellie. Right, I think we're ready for the raffle, are we?
Okay, yeah, I'm so ready for the raffle.
Okay, so here we go. There's the raffle page. We're going to do the draw now. Hope you guys are all ready. Let's go.
We almost need a drum roll.
Fantastic. Oh, fantastic. Laura Richards, well done. And that's actually so fitting because you've been so active throughout. And I think Izzy will probably say as well that we've seen you being quite active with the questions and participating really well. So that actually works out really well. Well done. Pop me an email and we can discuss a prize for you. Once again, it can be a TEP accessory, or we can sort out a module for you. Fantastic job. Absolutely amazing. Right, guys, that was brilliant. Just a reminder that we're doing this to try and raise some money so that we can do another event like this. So please take advantage of the 24-hour sale. We need at least 50 people to buy this African lion surgery module. If we can get that, then we can fund the next one, which can be another species as well that we can do the same thing on. So very exciting. To everyone that has participated and joined in tonight, thank you so, so much. To the panel, thank you so much for all your hard work in getting ready for this and prepping the special edition live stream. It's been an absolute pleasure. And the next live stream is going to be on the 7th of December. So we'll be back with the next one. And I think that's about it from us, unless anyone's got any final words.
Thank you, Roger.
Perfect.
Yeah, thanks for joining, everyone. Thanks, Roger.
Yeah, thank you, guys.
Thank you.
Cool, guys. Thank you so much. See you soon. Bye.